So my name is Dr. Ugo Egolum. I'm an advanced heart failure and transplant cardiologist at the Georgia Heart Institute here at Northeast Georgia Medical Center. I'm also the program director for the Cardiology Fellowship Program and also direct our LVAD program here. I think our fellowship program is great to begin with. I'll say that just to summarize it in a nutshell. I think there's several things that really set our program apart. So number one is the camaraderie amongst our faculty and our fellows. We try to create and foster an environment of people being inquisitive, asking questions. We have people of various background, diversity that come together really to have a sort of a family atmosphere. Then I think the other part that really sets us apart is our clinical volumes. Right? We have lots of patients that come from all over Georgia that come to get care at our facility. And that really creates a rich environment for fellows to be really engaged and learn all the nuances and the different aspects that go into cardiology. So from a cardiology perspective, we have excellent imaging modalities, echo, nuclear, CT, MRI for imaging purposes. We provide really excellent care for our patients on a clinical level, whether this is consultative cardiology, seeing patients in clinic, getting them scheduled for testing. That part is extremely well run and organized. And then when we look from an interventional cardiology perspective, there's a full gamut for the patients that need a basic diagnostic cath. And we go all the way up to patients that need complex coronary interventions. So having that in place really allows the patient to have the full scope of care. On top of that is also the structural heart program, right? So we're doing mitral clips and tricuspid clips. Again, very advanced technologies that are being applied for the care of patients. And to my side of things, from a clinical perspective, heart failure, right? So we provide the basic care that's needed for medical therapy, but for patients that are sicker that may require LVAD therapy, mechanical support, all those modalities are clearly evident and available. And then also more advanced or nuanced sort of cardiomyopathies where we're talking about treatment of sarcoid cardiomyopathy, or we're talking about cardiac amyloidosis, pulmonary hypertension. So really all that stuff is provided in-house. And then from a CT surgery perspective, I think we have the luxury of working with a phenomenal group of surgeons. We have readily available minimally invasive surgery where patients can have bypass surgery done without splitting their chest open or traditional sternotomy. Top-notch surgeons for valvular disease and aorta disease for interventions. And of course, like I mentioned, too, our vascular surgeons are a really phenomenal group of folks to work with. They're very engaged with teaching and working with fellows. So if we look at carotid artery disease, vascular access issues, things like that, we've got a gamut of expertise. So I think when we look at the group as a whole, any fellow would really have wide exposure to all aspects of cardiology by coming here to train. So one of the common questions we ask is, what makes a great fellowship candidate? How do we select from our 700, 800 applicants we have for 6 slots? Well, I think the fellows that are going to do well here are people who come in with a strong work ethic, people who are willing to come in, roll their sleeves up, and engage with the team to learn. I think someone who has a humble disposition, someone who can come in realizing, hey, I don't know everything. I'm here to learn, and I'm willing to ask the questions and get the right responses. Thirdly, I think someone who values excellent communication. I think it's important to realize as a cardiology fellow or as a cardiologist, you're naturally someone who has to be a leader. So being able to engage a multidisciplinary team, the nurses, our nurse practitioners, the technologists, and the people that we work with. So really that emotional intelligence component, I think is a big part of it as well. And then fourth, I would say someone who's self-motivated, someone who's a self-learner, someone who doesn't wait to be told the right things to do, but they have a sense of what it is that they engage and get things going. So folks that are really interested in our program, if that's who you are, that's who you are at the core, and these are some of your own core principles, I think someone of that nature would do very well at our program. Yeah, so definitely. So we want our fellows to come in, work hard, learn. We're a busy hospital. It's intense. It's high volume. It's high action. But one of the things I love about being here is when you're not at work, there's plenty of opportunity to play and engage in the community. I think one of the things that's lovely about North Georgia is the crime rates are low, housing is relatively more affordable. We have really beautiful nature. If people are into hiking or things of that nature, there's ample opportunities to get into it. If you're a water person and you like being by the lake's up here in North Georgia, so there's a lot of opportunities to get into. The mountains is just a beautiful, lovely community to live in, and there's really different neighborhoods you can be part of. I would also say the school system, for those who have children, is really great. You can send your kids to public school, they have excellent education. But above and beyond just the amenities, I think you'll find that the people here are genuinely nice people. They're kind, people smile, they're engaged, they're willing to help. So it's really a great place to work, play, live, and just be part of a great community.